Hello, I'm Dr. Robert Spaulding, and this is a lecture on podiatrists hiring nail techs as medical nail techs for DPM salons and RNs as foot care nurses for their facilities. Disclaimer and background information. All material in this presentation is copyrighted 2006 to 2023 by Dr. Robert Spaulding and cannot be copied or shared without permission. The first version of this presentation was in 2006. This MediNail video is part 1 of a 4-part series. Part 1 is basic setup. Part 2 is market forecast. Part 3 is the differences between the ANT, MNT, and the CCPMA programs. And Part 4 is using a foot care nurse in a podiatry office. The following is information on podiatry-based salons. All MediNail training is doctor tested and salon tested since 2006 with the advent of my book, Death by Pedicure and the Science of Pedicures. We offer more integrated training to both the national and international salon markets and medical offices than any other program. So why are podiatrists starting medical spas and nail salons? The answer is to offer safer services and keep high-risk patients out of salons. Answer 2, why is it safer? The state cosmetology boards are poor stewards of public safety. They don't promote or accept the need for advanced training, autoclave sterilization, aseptic services, referrals to health professionals, or limit aggressive services. So what do podiatrists like most about the cosmetic side of the medical nail technicians working in their offices or working in their nail salons? Well, there's no insurance to file. This is all about developing a similar business model as medical estheticians working in dermatology offices or for dermatology, plastic surgeons, and other aesthetic physicians that have accepted estheticians as practice extenders. Here are following few top-rated podiatry-based salons that have been initiated and operated by podiatrists with staff trained by MediNail.com. Nail MD, your prescription for beauty. Richard Galpin in Dallas, Texas. He's also president of the American College of Medical Foot Care and Aesthetics. Concierge Podiatry Spa at Newport Beach with Dr. Roth, who has developed this concept. Las Vegas MediPedi.com, owned by Dr. Larkin. Dr. Hillary Brenner in New York City also runs a podiatry-based nail tech salon. Luetta Foot and Ankle Specialists in Spring, Texas have adopted pedicures, medical pedicures in their salon. Dr. Sheehan Stratham in New Hampshire has opened the Barefoot Medical Spa through a podiatry-based practice. Dr. Michael Horowitz in Chesterfield, Missouri has opened Clean Spa and has developed a lot of good new technology for this. These are simple, inexpensive conversions that you can do to open one in your practice. Here's my treatment room back in 2008, the room that it was a regular podiatry office room before. Here's my treatment room after. Just $200 worth of extra material to change the lighting and plants to change the atmosphere. I even added a manicure table with the manicurist back in the corner. The room setup is quite easy. You can have it more medical than spa or more spa than medical, using your own podiatry chair. Clients prefer it, and just a simple copper soaking foot bowl is all it needs to change that with a few plants. This changed the room with a simple conversion massage chair with a bowl built in and a mirror and 1 or 2 plants. Here's a simple conversion room in Knoxville, Tennessee with a pedicure throne type chair. You can have simple chair options. If you have a mid-marked podiatry chair, you can elevate it, put it in Trindle position, and do foot massages that will help improve lymphedema. What you need to do to start a salon in your office. If you're planning to open it to the public, you need an extra treatment room or rooms that you do not use or access for extra space that you can license as a salon full-time or just for certain hours. The key, most important, is a well-trained, competent medical nail technician. Look locally at nail schools and then get them trained. And for just a few $100s to convert your treatment room to a salon with the proper equipment is all you need. If you don't want to be open to the public, you can just train a clinically certified podiatric medical assistant or CCPMA to do your own routine foot care for your own high-risk patients that don't belong in a salon, and simply use a treated, enhanced nail polish and simpler, safer medical aesthetic treatments for cash. There are many product services you can add to your office or salon, like the enhanced nail polish treatment called Just for Toenails, one of the first ones out since 1998. Urea-based foams like Podo Expert are excellent products dispensed in your office. Medical pedicures, prosthetic nails such as Cariflex, Onifix conservative ingrown nail treatments, which is a new type of ingrown nail service that you might want to learn about regardless of whether you pursue this or not. Laser services that for fungal nails, those still do a good job in helping people who don't want to take oral medications. The price of lasers have gone way down, sometimes 6 times less than what was previously out there in the early 2006. Most of them have FDA certification for both physical therapy and treatment of fungal nails and wart treatment. What to expect? You need about 6 months to get a cash flow of a salon traffic going. You make more as a podiatry room than a salon, but now someone else is spending the time delivering these services, and that's where you have an advantage. If you advertise to the public for walk-ins, you need to register your salon and follow your own state's Board of Cosmetology rules for opening a salon or spa. MediNail provides the most up-to-date training and product information to offer you the best safety protection for you and your clients or patients. We train you in the best disinfection and sterilization practices available. Our training has the most information and the most competitively priced program anywhere in the world. There are free training courses available to sample and decide if this training is for you. To do this correctly, you have to be committed to the best sterilization and modern safety information to not expose your clients or patients. Part of this salon venture should include self-reviewing your own disinfection practices and universally standardizing routine foot care for all podiatrists by joining the following practices of the American College of Medical Foot Care and Aesthetics. Even if you don't open a salon, if you are still using these products below, stop. Stop exposing your patients to fungal or bacterial infections. COVID shut down virtually every nail salon in the U.S. Salons are coming back fast, and podiatrists should be the leader in nail salon care. After COVID-19, everyone knows that you need at least a 70% alcohol hand sanitizer. Everyone is now an expert. It's evident that major corrections are needed for our disinfection system in the United States. The key to developing a successful salon relationship with podiatrists: number 1, proper support personnel and advanced nail technician education through medinail.com. Number 2, attention to aseptic aesthetic detail, both in disinfection and hygienic ambience. Number 3, consistency in salon or routine foot care referral services. You just finished the MediNail video part 1 of a 4-part course series. Go to www.medinail.com to see the top menu under courses and click under the free course and see the following videos for the market forecast, Part 3, the differences between ANT, MNT, and CCPMA, and Part 4, using a foot care nurse in a podiatry office. Final note: many of the MediNail ANT and MMT graduates have better sterilization and aseptic care practices for routine foot care than some of the podiatry practices the MMTs have interned with. A podiatry-based salon is only for podiatrists who take a keen interest in providing exceptional routine foot care, for that to extend into the aseptic cosmetic services. You should not think of adding a DPM-directed salon if you just want to add a revenue stream to your practice. MediNail training is not about DPMs and MMTs meeting state cosmetology regulations, but exceeding state requirements. For more information, contact MediNail.com below at these various telephone numbers or email addresses.